why is that nausea and vomiting during a caesarean birth so common, impacting up to 80% of all women and people who have a caesarean birth? And is it because of that pulling sensation when the baby is being born, or are there other factors at play? And what can you do about it? And if you yourself had nausea and vomiting during your caesarean birth, what helped you the most? Drop in the comments below your big tips to be able to help those who are having a caesarean birth get through it far more positively. So whilst there are a few who will be sick during the point of all that pressure and that pulling sensations when the caesarean birth is happening and the baby is being born, most of the nausea and vomiting happens after the anaesthetic is provided. And that's for several reasons. So firstly, the anaesthetic itself, so the spinal or the epidural top-up, depending on which regional anaesthetic you're having, drops your blood pressure. When your blood pressure drops, it creates nausea and vomiting in itself. Now that can be easily rectified, and it's one of the reasons why your anaesthetist and your operating department practitioner or your theatre assistant are taking your blood pressure at really regular intervals. Normally every few minutes your blood pressure will be going off on your arm, so that way they can really monitor your blood pressure closely and rectify it with other medications if your blood pressure does plummet. Now the other reasons are because some of the anaesthetic medications that are given are opioid medications, and a side effect of any opiate medication is that nausea and vomiting happen. The other reason is when your baby is born and you're about to deliver your placenta, you'll also be given some oxytocin medications to help the uterus contract down and reduce the chance of you bleeding too much in caesarean birth. And a side effect of oxytocin is nausea and vomiting. So what are my main tips? Well, the first one is use your voice. In your pregnancy, I want you to learn how to advocate for yourself. I want you to be able to speak up whenever you've got any signs, symptoms, any problems. I want you to raise your voice. So in that caesarean birth, if you just that little bit of acid sensation in your throat where you think, oh, this is a bit different after that anaesthetic is given, I want you to say, I'm feeling a bit nauseated, I'm feeling a bit sick, can you give me something to help? The whole Cochrane review on nausea and vomiting during a caesarean birth and all the medications that can be used. The medication they give you will either be an anti-sickness of some sort, or it might be something that reverses your blood pressure dropping if that's the case. You using your voice and speaking up, they can treat it far quicker. And the other thing from a preparation point of view is it helps to get a vomit bowl to you closer. Now at this stage, your spinal or your epidural top-up is working more effectively. You can no longer move, so you're going to have to learn to vomit to the side of you and get it and spit it up that way. And the quicker that you mention that you are feeling nauseated and need to vomit, the quicker we can get you that bowl and it goes in there as opposed to all down you. It's much more dignified. Taking some deep breaths will also help to reduce the anxiety and the panic that might kick in at that stage. And the other thing that Cochrane has highlighted is that acupressure can be really helpful for nausea and vomiting during a caesarean birth, so something else to consider. And if you yourself found this video helpful, hit the follow button for more pregnancy and birth information. I'm Angie, I've been a practicing midwife for over 13 years, registered health visitor, breastfeeding peer supporter and antenatal and hypnobirthing teacher.